We've talked a little bit about like this, the anxiety side of this. We just mentioned that. But I guess there's another side to this that I wanted to kind of touch on, which is like sadness, depression, grief, hopelessness, right? I would imagine that there's a tendency to maybe want to instill some amount of hope in people, or that people want to instill an amount of hope into the person that's going through it, right? And I guess I'm just wondering, how do you balance that with being realistic?
Yeah, it's a good question. Speak to the point about the sadness, right? I think oftentimes it helps to look at what is happening when the sadness is happening. So sadness is a very tricky thing because it makes us withdraw. And our brains really like positive reinforcement. The brain likes to feel good, right? But what happens when you withdraw from the people you love, from the things that you enjoy doing?
Right.
There's really no opportunity for your brain to get positively reinforced, right? And so you're having an off day, you're not feeling all that great, you're feeling kind of low. You decide, I'm not going to do this thing that I usually do. I'm not going to go to the book club I normally go to. I'm not going to make that phone call to my friend that I usually make. And then the next day, feeling low again, motivation is decreasing again, right? And again, pulling back from the things that you enjoy that bring you pleasure. Then all of a sudden, it's been days, and your brain's had no opportunity to feel good. It makes sense why you're going to feel really sad.
Right.
Right? Like, what a human thing. Like, what a human thing to be struggling in that moment. And so oftentimes working with sadness is processing the thoughts that are fueling it and finding ways to engage anyway. There's this like concept in behavioral activation called action before motivation, right? Depression is really good at zapping all the positive affect out of you, all the motivation, right? How do we build that up slowly so that it feels more natural?
By doing it anyway.
By doing it anyway, exactly, right? And to comment on the concept of hope, I think hope is a very important thing. I think hope is what allows people to be resilient in the face of a very challenging situation, helps people engage in their care and ask the questions that they need to ask, and get through the symptoms that they might be experiencing, right? But there was this concept that I was exposed to very early in my work at Memorial Sloan Kettering. There was this person, her name is Jimmy Holland. She's sort of like the grandmother of Psycho-Oncology. She used to talk about this concept of like the tyranny of positivity.
I was perfect. You read my mind as to what I was going to ask you about next.
Right?
Yeah.
Like, hope is not the same thing as like the tyranny of positivity. Hope is not the same thing as like, you have to think positive, right? Like, you're going to beat this. Like, don't think negative, right? These are very separate concepts. I think hope can be realistic. Hope is not being blind to the situation. Hope is understanding and having and being willing to think about the future anyway, right? I think a lot of patients with cancer, or many patients with chronic illness in general, there is a pressure to just be okay.
Yeah.
Right? To be a fighter. You want to be the survivor. Right? But sometimes it's just really hard to have cancer. It's really hard to feel bad, physically and emotionally. That can be okay. Two things can be true at once. You can have a day where you are just struggling and you're still hopeful.
I said you read my mind, because when you started talking about like the toxic positivity stuff, again, I've been blessed. I'm lucky. I've never had this experience before. And I have had clients who, and people I know who have had it, and they confide to me about how it feels. And I guess I'm curious how often this comes up in clients' treatment, this toxic positivity thing.
It comes up a lot, right? And I think something that's been helpful to talk about with people is like, why is this happening? People don't like to see other people struggling. People don't like to see other people sad, sick, right? It's coming from a good place, but it doesn't feel good for the patient, right? It could feel really invalidating. Or oftentimes patients will say, I feel like I don't have anyone to talk to, because if I tell them how bad I feel, if I tell them how much I'm struggling, then they're going to feel bad.
Mm-hmm.
They're going to want to fix it.
Mm-hmm.
And like, what is that saying? It's like when somebody is upset, you want to ask them, do you want a solution or do you want a ear?
Yeah, yeah.
Right? It's like, do you want me to fix this problem for you, or do you just need someone to talk to?
Mm-hmm.
And oftentimes when I'm working with families of patients who are navigating cancer, that's one of the big things that comes up. There's a desire to fix,
Mm-hmm.
right? Whether it's problem solving or just, that positivity, like let's just think positive and not think about any of the bad stuff, right? While that's understanding, it might not be what the person needs.
Yeah, and I guess the thing that I don't want to say it's not coming from a good place, but I also wonder how much of that is just the person's own discomfort or anxiety about, like, I don't know what to say.
Yeah.
I was like, we've reached the Andy's therapy portion of this interview. You ready? Mm-hmm. Okay. I was thinking about the fact that I was going to interview you. And then I had this thought, which was, oh my God, man, like I know so many people who have been diagnosed recently, like in the past year and a half, with some form of cancer. Some of them I'm closer to than others. Honestly, a lot of them are sort of on like the periphery of my life, but like people that I like, right? And even me, who's like supposed to be a therapist and like be emotionally intelligent and like know what to say, I almost feel like it's more difficult for me to know what to do for those people. Like I want to reach out to, I don't know what to say, right? So like, as I'm sitting here saying like, from a patient's perspective, I could understand that being so goddamn annoying. Also from a person who knows people who are experiencing this perspective, I can really relate to like not really knowing what to say. Like, what do you say? Do I reach out to a person that I wouldn't normally reach out to ever, right? I've donated to like GoFundMe's or like maybe just say like, how you doing next time I run into them. But like, even for me, who's supposed to be, now whether or not I actually am is another story, but emotionally intelligent and has difficult conversations with people for a living, it's hard.
Yeah.
So I guess maybe what I want to ask you is like, and I have a feeling what you're going to say is it's probably different for everybody. If I was to come to one of your groups and pose this question to them, what do you want people to say to you, to ask you? What do you think they would say?
Do you mean from like a loved one's point of view? Like how do you support someone?
Maybe both.
Yeah.
So, someone who's close to you and someone who like just wants to like say like, hey, I'm thinking about you. Yeah. Maybe that's the thing.
I think when people are struggling with how to support someone that they know who has been diagnosed with cancer, I think my most basic advice is to meet that person where they are at and just be there. Supporting someone can look very different from day to day. Sometimes support is just checking in. Hey, how you doing? Sometimes support is just sending food over, right?
But again, these are people. For me, I would never send them food.
Well, so maybe food is not it, right? But I think that it's, when I think about how do you support.
I'm sorry,
no, it's
I interrupted you because you
okay.
were answering the question about a loved one.
Yeah, no, well, even like if it's someone that's more tangentially related to you, like an acquaintance, right? Let's use an acquaintance as an example, right? Let's say someone I went to school with many years ago is diagnosed, right? And we keep in touch here and there, but we're not friends, we're not hanging out on the weekends, right? Send a card. You can send a card. You can send a message, right? The person gets to decide how they want to respond to that, right? And I think support isn't about forcing a fix on someone, right? Like, we can't fix what that person is now going through. All we can do is let them know that we're here for them in whatever version of that is. And I think sometimes people hesitate to reach out because they don't know how to reach out the right way. Like, how do I maximize this support that I'm giving? How do I make it the most useful? You might not know what's the most useful for that person. So I would say maybe let's take a step back from overthinking. And what is just a way to connect?
But I'm really good at overthinking.
Well, aren't we all? Again, overthinking can be beneficial in a lot of ways, right? However, if the overthinking makes it so that now it's 3 weeks later and you still haven't reached out, right?
Yeah.
Because we're still trying to find that perfect way to provide support, right? It's emotionally taxing, right? And it takes away from the very thing that we're trying to do, which is make sure this person feels supported and connected.
Okay.
I don't think there's a perfect answer, right? And this is, I think this is very reflective of a lot of the conversations that we have in therapy, right? Sometimes we get posed these questions where there is not a perfect recipe.
Totally.
I don't have the exact answer, right? But what we could do is we could try to find a version of something.
Fair enough. And I would imagine it's different from person to person. And from person to person, it's different from moment to moment.
Yep. What someone might need when they're first diagnosed is probably going to be very different than what they need during survivorship, than what they need while they're going through treatment, what they need when they're going back to work after being off of work for 3 months because they're going through treatment, right? It changes so often, and I think the support that you can offer can change, and that can be okay.
Okay. I wanted to ask you something more personal, if that's okay.
Okay.
I guess I'm just wondering what lessons have stuck with you personally that you've learned from patients or from doing this work.
I think that this work has really changed my perspective and how I think about like connection and how I think about like the choices that I make. Every day I work with people who are faced with such limitations and yet they find a way to navigate anyway. And so often when we're kind of going through our lives, right, like I think about being at ShopRite and getting frustrated that the line's too long. Right? And I think this perspective that I've developed is sort of like, how do I stay present in the moment and manage that discomfort and still find ways to connect and feel like I'm living in line with what's important to me? Because it's so easy to lose track of that. And I think being able to bear witness to the strengths that my patients showed has really instilled in me this value around being able to do that myself. Whether it's for the mundane everyday things or it's the big things in my life, is how do I stay true to who I am and what's important to me? Because if I can do that, I can ultimately navigate whatever challenge is faced in front of me.
So this idea of like resilience and gratitude?
Yeah, and that it's okay to be upset sometimes, right? Like this idea of like, we are all faced with challenges every day. One thing that we talk a lot about in our work is that a person with cancer is not just a person who has cancer. Cancer does not happen in this perfect little vacuum where nothing else happens, right? You have a life outside of the cancer, right? There are things that push you every single day that are challenging, right? This is a shared human experience, right? And what is it like to give ourselves the self-compassion that we're so willing to give other people?
Yeah, it's hard.
Right?
Yeah.
What is it like to sit and acknowledge that we're having a hard day, that things are really tough right now, and that isn't a signal that we're weak. It's not a signal that something is inherently wrong with us or we're not doing enough, but it's a signal that we need a little bit more, that we have to show up for ourselves and find ways to connect. I think that work I do with patients, I try to practice in my own life, and it's a good reminder because it's hard, right? Even as a therapist, we've been trained in it for how many years, and we struggle to do it ourselves, right? And I think that's what allows therapeutic work to be actually so meaningful, is that human connection of, you know, we don't have the exact shared experience, right? But that experience of being human and struggling is very real and something that we can grow from.
This is my favorite last question to give people.
Mm-hmm.
I'm going to give you a magic wand.
Oh, okay.
You ready?
Mm-hmm.
With this magic wand,
Mm-hmm.
you can say anything you want to anyone who's just been diagnosed with cancer, what would you say?
I think it's very related to my last answer in that there is no right or wrong way to experience emotion when you've been diagnosed with cancer. A diagnosis can come with it fear and sadness and anxiety and anger, right? There's no right or wrong way to feel, and it is okay to feel that. What I would want people to then know is that you are not alone in that experience and that there is support available to you, whether it is through the support network that you've developed, your friends, your family, the people you love, or whether it's through more formal avenues like a psychotherapy service, right? This is a challenge that you do not have to navigate alone, and asking for help doesn't mean you couldn't do it alone, but that you are worthy of having that support and the care that you need to navigate it.
I think that's good.
Good?
Beautiful.
Good.
All right.
Good?
Well, thank you so much for coming to talk to me.
Of course. Thank you so much for having me.
It was a pleasure.